what is the landscape like, Mr. Mugisha?
I think from the provider,
especially when it comes to quality service provision.
Thank you very much. One of the things that we have seen over the last few years, just like Doctor has mentioned, the drive to reduce, for example, mortality rate has seen an increased investment in the private sector. Okay. Even government has invested quite a bit to make sure that maternal services are given the spotlight. You'll notice that a lot of babies were being lost, for example, prematurely. We have seen a lot of improvement in that kind of space. I'll give an example as a hospital. We have grown our beds from 10 to 16, but around the country, most facilities are putting up neonatal intensive care units. Why? Because we have seen a lot of mothers giving birth quite late. Most of the babies end up being born prematurely, and they need to survive. So a lot of babies were being lost because they did not have care when born, for example, at 6 months or 7 months or 8 months. So that has seen a lot of shift, and that's why you see that mortality rate, especially for babies, is coming down significantly. But also, there has been a lot of advocacy in maternal health. For example, if any mother approaches any facility in labor, you have to deliver that mother, whether they have money, whether they have any kind of support, they need to be delivered, and then safely, and then probably transferred to a facility that can accommodate them for free. But the first instance is to make sure that baby and mother are okay. So advocacy, but also investment, intentional investment, even from government. You see the Mulago maternity unit is come up strictly for maternity issues to make sure that babies are born in a safe environment, mothers' lives are safe, but also the private sector is not staying back. A lot of maternity focused centers are coming up, but also investing in post-maternal services like neonatal centers, the ICUs in case a mother needs support. A lot of these are coming into play to make sure that the whole value chain is secure for the mother and child.
Okay. Allow me to stay with you on account of something that you shared. The fact that a mother or a woman in labor can come in and what should be done at that point is to safely deliver her of the baby and not necessarily to look at how much they are bringing in. I just want you to throw more light on that in light of the private sector and how things are conducted therein. I'm failing to understand how a private organization fronts that, because we've had incidents where, for example, some clients, as they are referred to, have been held on account of coming in and either not paying the initial fees that are supposed to be disbursed at the counter. Just throw more light on that and maybe we can understand it more. How does Nakasero Hospital do it?
For instance, I'll give you a good example. Medical ethics. All the medics know it very well. Any person with an emergency should receive care, regardless of their financial status, regardless of any other condition. Anyone coming in, for example, with a heart attack, and the first place is Nakasero Hospital, the people have just dropped him there. We should be able to stabilize that patient without asking for any money, and that's what we do. A lot of accident victims have been dropped at the hospital. The job is to stabilize, even as far as providing some life-saving interventions like surgical. Then once the stabilization has been done, you can then go into the discussion of, okay, where do we refer you to? Those who can afford to stay will definitely stay and receive the care. Those who cannot, then can be transferred maybe to a facility, maybe a national facility that can take care of them, at no cost. So it cuts across all medical conditions, even across to maternity. A mother coming in labor at the 11th hour, she couldn't get maybe to the hospital where she intended to go, and they have brought her to any facility. You should be able to deliver that baby and then discuss anything else after that. And if they cannot afford your facility, you've done your bit as an institution.
Okay.
Promote health, yeah.
That's quite commendable. Dr. Amadriyo, what is the situation like, especially in rural areas? When you hear the kind of care that is dispensed in urban centers, you might get the picture of, or rather a distorted picture. In the rural areas where traditional options are still heavily entrenched, how are you health sector players tackling this particular situation? It could be a problem, it could be a positive challenge that is happening. How is it like?
Okay, so in the rural areas, the choices that mothers make are influenced by a number of things. Importantly, knowledge, knowing what to do, knowing where to seek care from. So for those that do not have the knowledge, then they don't have many choices to make because they don't know what choice to make. But there are also those that make choices even when they have the knowledge, because they have this mulera in the village that has delivered generations of people.
Yeah.
And they believe in her so much. So there are those that make that choice.
That is right.
Yes, but there are those that know they should go to the health facility, they will go and attend antenatal care services and receive them. However, when it comes to the time of delivery in rural places, we find that transportation comes in as a key, because in maternal health we have what you call delays. So there's delay to make the decision to go to hospital, and that is usually influenced by knowledge, knowing that when I see blood and I'm pregnant, that is a danger sign. It's a risk factor. When I see this, the baby is not playing, that is a danger sign. So deciding that I should go to the facility, that's delay. But the second delay is now in reaching the facility, where transport comes in. So someone is waiting for a motorcycle to come pick them, and they are miles away from the nearest.
The road is also rough.
Yes, the road is rough, and she has to make that journey to the health facility. It's different from in Kampala, where maybe jam will be the problem, but you most likely have a means to get to where you're going. And even that mother having a boda to pick her maybe a plus. Not many do have.
That is right.
So there is that delay, and then the third delay is delay to take action at the health facility. So we have
the staff.
By the staff, and this can be hindered by a number of things: staffing levels, supplies. Shortages of supplies could hinder the health workers from taking action in the time required. So that would be what you see in the rural areas. However, they may not also have the private facilities to use as an option readily available if they could afford it. So those may not be so much, to their disposal.
Okay. Mr. Mugisha, you talked about the referral option, and that one is quite commendable. But many times we see and hear cases where referrals have been made, but then patients' condition deteriorates on account of first being attended to by very dedicated expert staff, and then referred to a government hospital where the challenges are existing, including understaffing, a lack of drugs available at that particular facility. Is there interagency cooperation, for example, that allows for improvement of the care systems in terms of emergency, so that we can know and have a tracking system that says if this number of women were dropped or victims were dropped at a facility like Nakasero Hospital over the last 3 years, when they were referred to a government facility, did they come through? That kind of positivity.
I think in terms of statistics, interagency, the cooperation is there at the level of support.
Yeah.
But in terms of, I think, tallying the numbers, that is something that we could probably, follow up as I think as a sector.
Okay.
But as a hospital, even before a referral is made, we need to make sure that they are going to a place that can handle their condition. There are cases that have been delayed to be referred because the facility that we would want them to go to, maybe the ICU is full. and they need ICU. So we don't just refer, we ensure that where they are going, they can actually support, because there's an exchange of a medical report, this is a condition of the patient, we know what kind of support they require. So we are sure that where they go, there's a very high chance that they're going to be okay. So at that level, there's a lot of support and a lot of collaboration to make sure that happens. And at times, they have gone to another private facility. Again, it comes down to who is the payer. It could be your insurer, covers you at Nakasero, and doesn't cover you at Nakasero, covers you at another facility. And it could be transfer the patient to this facility, and that's also another option. So it's not just government, there's also private to private.
Okay, but our statement on insurance does cover my next question, because I was going to say, for example, what particular reforms are necessary to ensure that in case ICU is needed and other referrals are full, Nakasero itself can use its own ICU on account of knowledge and being sure that the cost will be met at any one point in time. I'm afraid we are running out of time. I want to ask the very last aspect, nutrition, especially during pregnancy, and how it can contribute to maternal death. What should the average woman do or know, especially when it comes to how they feed, very quickly?
Okay. Nutrition is very key, both for the mom and for the baby that is growing within her. So a number of things in our diet contribute to the things that someone needs. So we need things that build the body, call them protein. We learned this in like primary school, bodybuilders. So protein diet is very important. Yeah. Iron is also a very important thing that mothers need, and the sources of iron are things like millet porridge. Silverfish, mukene. We usually don't like that, but it's very important to have that. It's a very good source of iron. And we need iron because mothers get anemia. They get anemic, or locally would say their blood levels drop, because their body is supporting them, but also supporting this infant that is growing within their womb. So anemia is one of those things that are really key in terms of nutrition or supplementation. So that's why you see that a number of women will tell you, I'm giving the red pills for blood to we are trying to make sure that they're not anemic. And because also when a mother is anemic, when she comes to deliver, just a slight loss of blood will tip her over into what we call postpartum hemorrhage or failure. Yes.
All right, postpartum hemorrhage. There is the aspect of postpartum depression, but the conversation will be stretched beyond the time that we have today. Many thanks for bringing us up to speed with what is happening, but most importantly, a reflection on how things can be improved in order for us not to lose our dear mothers and their unborn children. That's it for the Tech Note. Do stay with us. Morning at NTV does continue.